Like and subscribe and click the bell icon to get new video updates.
Nurse tells Coronial Inquest Veronica Nelson's first prison health assessment was inadequate. A nurse has told a coronial inquest she suggested sending Veronica Nelson to hospital the day she arrived at prison, but was overruled by a doctor who said the 37-year-old looked generally well, 2 days before she died alone in a cell. The family of Veronica Nelson have granted permission to use her image and requested she be referred to as Veronica on second reference. Nurse Stephanie Hills recalled being told "You're just a nurse" by the doctor, who did not believe Veronica needed to be sent to hospital at the time. Veronica was found dead at Dame Phyllis Frost Centre in Melbourne's West in the early hours of January 2, 2020, after making multiple intercom calls for help. An autopsy found she died from complications caused by a rare medical condition affecting the intestine and heroin withdrawal. On Monday, registered nurse Stephanie Hills told the inquest she was alarmed by the Gunditjmara, Dja Dja Wurrung, Wiradjuri and Yorta Yorta woman's appearance when she arrived at the prison on remand on New Year's Eve in 2019. Ms. Hills broke into tears before telling the coroner she had to physically support Veronica as she took her blood pressure during her first health assessment because Veronica was unable to support herself in the chair. The registered nurse said after observing Veronica's low heart rate and blood pressure she told the doctor, Dr Runacres, who was running the examination, it was her opinion that the unwell woman should be sent to hospital. I expressed my concern and stated that, "Do you think we need to send her to hospital?" Ms. Hills said. She said he responded by saying, "I am the doctor, I will make the decisions. And I believe there was just a nurse thrown in there as well," Ms. Hills said. She said due to the medical hierarchy there was no way a nurse with a doctor before them could override that decision and call an ambulance from the examination room. "I did have concerns, but at the end of the day it's the doctor's decision, what they do and don't do," Ms. Hills said. The nurse told coroner Simon McGregor that some of the observations recorded by Dr Runacres in the health check were not actually gathered during the examination she witnessed. She said that was partly because it was not possible to get Veronica onto the scales to be weighed or onto an examination bed for a proper abdominal assessment. The court heard the examination lasted around 13 minutes, which was 15 to 30 minutes less than what it would normally take for an assessment of that kind. Ms. Hills said she felt at the time the health assessment was not adequate and a proper test of Veronica's conscious state was not done to justify the normal Glasgow Coma Scale score noted on the health paperwork. Dr Runacres didn't move from his chair and he didn't examine her pupils either to see if they were dilated, reaction, anything, Ms. Hills said. She said Veronica was frequently incoherent, struggled to understand the health paperwork she was signing and repeatedly told the healthcare workers, "I feel sick, I have pain." December 30, 2019, Veronica is arrested, interviewed and taken to the Melbourne Custody Centre where she is remanded overnight. December 31, 2019, Veronica represents herself in a hearing where bail is denied. She is taken to the Dame Phyllis Frost Centre that afternoon. Overnight, she makes multiple calls to report cramping and vomiting and request a drink. January 1, 2020, Veronica makes more calls to report her symptoms. She is examined by a doctor and given water-soluble electrolytes, but continues vomiting. She is transferred from the medical unit to the main part of the prison. As night falls, Veronica's calls for help escalate to screams. January 2, 2020, Veronica makes her final calls for help around 4 a.m., then the calls stop. Veronica's body is discovered at 7:50 a.m. In his notes, Dr Runacres noted that Veronica looked generally well, was alert but not drowsy, and not toxic looking. Ms. Hills told the court she absolutely disagreed that Veronica appeared well. She was not alert, she was drowsy, she was slumped over the side of the chair. As I've already stated, I have no idea what not toxic looking is, I have never, ever read that in a medical file, she said. Dr Runacres, who was due to finish work when Veronica was examined, prescribed her with what is known as a rapid withdrawal pack, containing opioids, anti-nausea medication and paracetamol. Ms. Hills said after Dr. Runacres had left, she overruled his decision to clear Veronica and send her from the medical unit to the general part of the prison. Instead, she organised for her to stay in the medical unit overnight for closer observation. She said she did so after consulting a psychiatric nurse whose note from Veronica's first day in the prison recommended she